Anne Ramoyne, professor of epidemiology at the UCLA Fielding School of Public Health. Welcome back to the show. We reached out to Taylor Farms for a statement, did hear back from them, but we did hear from Taco Bell. They said, quote, "The affected ingredient from our supplier is being indefinitely removed from our supply chain nationwide and will be replaced within 24 hours in select states." So there's a lot of people watching this in the Midwest right now who had Taco Bell recently. What should they do? Should they be concerned?
Well, listen, the bottom line is that we have foodborne outbreaks all the time. So, you know, we now have good news here. We know that that many of these cases are linked to shredded lettuce, and as far as we, you know, from what we understand, and there's now something to be done about it. So they're pulling the produce. That's great. If you've had Taco Bell, you're in the Midwest, you're in the areas that have been affected. This is very regional. Yeah. Then you know you should be watching for symptoms, and if, in particular, if you had something with lettuce in it, you can be watching for symptoms. But the good news is that this particular parasite is not something that has a high case fatality rate. I mean, you can have some very uncomfortable gastrointestinal symptoms associated with it, and you should definitely let your doctor know if you start to have those symptoms so that they can test for cyclosporiasis.
Yeah, I mean, the gross phrase that's been out there is that it's explosive diarrhea. So if that starts for you, I mean, you say tell your doctor, is there anything else that can be done for you, or is it just sort of you got to suffer through it?
Well, there is treatment for it, and that's why it's a good idea that if you do have these symptoms, that you go seek medical care. They'll do a test, most likely. I mean, they may treat you empirically, but they may do a stool test, and it has to be ordered specifically to test for Cyclospora. Some of the panels that are normally done don't cover that, so it's really important to let your doctor or your health provider know if you're going to the doctor that you have had a potential exposure.
If you have eaten Taco Bell outside of the Midwest, are you in the clear?
It seems like we're not seeing upticks in cases in many other states. Where we've seen this enormous rise has been in Michigan, Ohio. It seems like there's some links in some other places. So I would still pay attention. I mean, once you know that there, is some potential exposure, I would pay attention. But for example, where we are in California right now, cases have not increased. And that's what we do, in public health and in epidemiology. What we do is we're looking for trends in terms of number of cases. And we're not actually seeing here in California a rise beyond what is the norm at this time of year.
Do we know that this is the only cause, or is it possible there are other causes in terms of what's next now that we've got this key piece of information?
Well, with so many cases, it's very possible that we could be seeing other outbreaks occurring simultaneously. And, it could be, we'll know a lot more as the investigation continues. And that's where these people in the public health departments, they're investigating, they're talking to people who are sick. They're going and doing these interviews where they're asking, well, what did you have to eat? But with Cyclospora, with cyclosporiasis, this is something that you could have had 10 days ago. Yeah. So it's a very intensive interview.
Right, it's hard to remember what you ate yesterday, much less 10 days ago.
Exactly, and so there's an extensive process. We will certainly get to know if there are other fruits or vegetables that are potentially associated with this. It could be multiple outbreaks, but it does seem like, this is a perfect example of you have a break in the chain, gets into a supply chain, you have something like shredded lettuce, which then is going to be distributed to lots of places. You can see how quickly a public health issue can become not just a small thing, but to many different places.
But there is good news here, and so it's good to hear that there is good news and that we're making progress, and hopefully that means that fewer people get sick.
Absolutely.
Anne Ramoyne, always good to see you. Thank you so much.